All right, everybody, this is the last video in this three-part series about COVID. And I'm gonna change it a little bit. I've been talking previously about long COVID patients, but the question is for everybody out there who hasn't been sick yet, how do you increase your resilience? How do you improve your immune system? How do you decrease inflammation? And for that, I want to talk about one of my prior patients who was an 83-year-old male. Now, I started seeing him and actually his wife about 2 years ago. The reason I actually started seeing the couple was the wife had Alzheimer's and was a part of my Bredesen protocol clinic where we deal with people with brain inflammation. How does inflammation affect your brain? And how can we work on that? And so they were living in a long-term care facility and they didn't really have a whole lot of control of their food and environment. But so we started working with the couple. And what happened was the husband ended up getting most of the benefit from it. He ended up losing 25 pounds, stopped eating gluten and dairy and a lot of inflammatory foods. We found out he had a lot of nutritional deficiencies. Like a year and a half ago, we found zinc was low, his D was low, his A was low, his E was low. He had a lot of markers for inflammatory fats. His gut testing showed he had a lot of inflammation. So he's kind of worked through all these things. And after about a year working with him and his wife, they decided to stop working with me, mainly because the goal was the wife, and things weren't working out due to her medical conditions. So he kind of thanked me for helping him, and it enabled him and the way he looked at it was enabling him to care for his wife better. And we were actually all happy with that. And the wife was happy for me to stop asking her to stop eating ice cream, which she loved. So I got an email from him this past summer. And the long-term care facility he was living at got hit with COVID. And a lot of people there got sick. Several died. And he got COVID as well. And he was ill for maybe 2-3 days and got better. He had a minor respiratory tract infection, like a regular upper respiratory tract cold. And the email he sent me was very encouraging. He talked about his health before starting working with us, how he did have gut issues and didn't always have he wasn't as sharp as he wanted to be. He was very educated, well-educated individual. And he had gotten back a lot of his cognition while working with us. And he credited the work he did, changing his diet, losing weight, addressing his nutritional status, for the fact that at 83, when he got COVID, it was a relatively mild case. And it's really interesting what we know about COVID. We know that today, that 87% of people who die with COVID have a low vitamin D level. So that means 9 out of 10 people who die with it have a low D. We know that if your zinc is low, you have a 50% increased chance of hospitalization from it. We know that if you're taking things like famotidine, or you're taking if you're someone with who takes a lot of antihistamine allergy issues, that actually lowers your risk of severe COVID, because we now know COVID has mast cell issues, and up to it lowers your risk for hospitalization up to 50%. And it was really interesting that Pepcid is one of the things that the local hospitals are now using with patients on the COVID ward. That's being used here at the local medical college. It's one of the things as well that Walter Reed, that the president of the United States, received when he was admitted to the hospital. Well, my patient was able to address these nutritional issues, address some of his allergy issues that he's had as well. And he was really super thankful that he had a chance to work with us. And so resilience, how do you build resilience? How do you build your immune system? Ultimately, it's a lifestyle, whole person, science-based approach where you deal with yourself individually. So again, share your ideas, share your thoughts below in this video. one of the things we're trying to do is create a online community where we can have talks about inflammation, gut health, resilience, and create an educational community where people can share ideas, but we can also guide people through their health. And so hopefully we'll be launching that in January. But as we kind of prepare for that, I want to let people to be aware that you can take charge of your health. You can improve your immune system. You can thrive. You don't have to just survive. And these are messages we want to give people to encourage them, empower them, and educate them. So anyway, take care, be well, have a great holiday season, and we will talk to you all soon.